Now, a week ago, the nation went to the polls and elected the Labour Party on the back of their promise of change and national renewal.
Perhaps the toughest challenge for the new government will be dealing with the future of the NHS.
And the man tasked with the job is here with us now. Please welcome the Secretary of State for Health and Social Care, Wes Streeting. Good morning.
Good morning.
Secretary of State, have you got used to people addressing you like that yet?
No, I keep on referring to myself as a Shadow Health Secretary. I keep on referring to the Shadow Cabinet. It is a big change. We've been in opposition for 14 years. We obviously slogged our guts out to make sure that we won the mandate that we did, and now we're cracking on getting to work. And the difference between opposition and government is night and day, because when you're in opposition, you go into work saying, what are we going to say today? When you're in government, you go into work thinking, well, what can we do today? And that is the big change, and one where I think we're all relishing.
Could a Secretary of State sit quietly in a pub and watch the match? I mean, what was it?
No, I discovered last night. Obviously, I played a big role in Labour's campaign, so my recognition has gone up, and I found a nice little corner of a pub in central London last night and sat with a mate watching the match, having a chat, and as soon as the half-time whistle went, people sat in front of me, turned around and went, oh, good luck with the NHS. So, but that's the general vibe at the moment, I think we're all finding. Whether people voted for us or not, people want to see the NHS back on its feet. They want to see a government that does what it says. And so I hope that for people watching who didn't vote for us, that, you know, like lots of people have bumped into in the last week, they're at least giving us the benefit of the doubt and saying, OK, you've got the chance now. Let's see what you do, and we'll judge us on our actions.
Yeah, there does really seem to be a level of positivity out there and willing you to do a good job. But you've got, I mean, it's really stacked against you. I'm going to give you some stats
give us all the
In England, 5 million are waiting longer than 2 weeks for a GP appointment each month. The NHS waiting lists of pre-planned hospital treatments have topped 7.5 million. 1 in 3 cancer patients, which, of course, you know, wait longer than 2 months for treatment. Tooth decay is now the #1 cause of hospital admissions among children aged 5 to 9. Do you still want the job?
Yeah, I wouldn't have wanted any other job. As you kind of referenced there, Kat, the NHS saved my life when I went through kidney cancer a few years ago, and I can't think of a better way to spend that life than giving it to saving the NHS. And the truth is that the NHS isn't there for all of us when we need it. And last week I said in very blunt terms that our NHS is broken. And actually today what I've done is asked Lord Darzi, who's been a surgeon in the NHS for 30 years, to do an independent investigation to look at the true state of the NHS, because we can all see, and those stats bear it out, the state of the system. And whether you're patients who use the NHS or staff who work in it, we can see it's broken. But already, just in the last week, when I've been in the department and talking to officials about different challenges, it sort of felt like walking into a house where you can see the state of disrepair, but what Ara's going to do is peel back the carpet and look at the floorboards and the foundations, because unless you get the right diagnosis of the problem, you're not going to come up with the right prescription. We're going to have a 10-year plan for the NHS, and I think the starting point has got to be being honest with ourselves and with the country about how bad things are, not least to create a baseline that people can judge us against. I want to come back in 4 years' time and sit on this sofa and say, well, this is what Lord Darzi said was the situation back then. Look at the difference we've made now, and I want people to be able to judge us on the improvements that we make. Yeah,
you mentioned your kidney cancer, which you are now clear. And you were helped by the NHS, and that is a real passion that you clearly have, obviously. But also your upbringing. It was very diverse. Who was it who inspired? Yeah, I mean, it was, right? It couldn't have been more different from the two Bills, your two grandfathers.
Yeah.
Completely different. Who inspired you to want to do this?
I think I've got different influences in my family, and
Tell us about
people might know if they've read my book. The two Bills, my two granddads. One, Bill Streeting, served King and Country in the Second World War in the Royal Navy, as his father had done in the First. Strong patriot, staunch working-class Thatcherite Tory, by the way.
Yeah.
And huge influence on my life, the family member I was closest to growing up. Then on the other side of the family, Bill Crowley, who was Well, he served differently. He served at Her Majesty's pleasure. He was in and out of prison with a string of convictions for armed robbery. He had a very difficult, traumatic childhood. He was a victim of abuse at the hands of his father growing up, and that explains a lot. It doesn't excuse his crimes, but it certainly explains how he ended up where he was. And both from my dad's side of the family, in terms of, you know, work ethic, you play by the rules, you work hard. But my mum's side of the family, where, you know, my nan was a big campaigner for social justice. She fought on housing. She was a real rabble-rouser. I think I kind of grew up with political conversation in my family, and also having grown up experiencing poverty, living life at the sharp end, really understand that the choices we make in politics has a real impact on people's lives. And I think that's when you look at the government. I mean, I was really proud the other day. We are the most state-educated cabinet in the history of this country. And that's not to be rude or dismissive of people who went to private schools, but I think...
representative of the nation.
Absolutely. And I genuinely think that if you've got a cabinet and a government that looks like the country that we're here to serve, and Keir's talked a lot about service in the last week in particular, we're more likely to take decisions that work in the interests of everyone, not just a privileged few at the top.
And incredibly inspiring for those young boys and girls who are looking at going, I came from where Streeting's come from, and look what
he
he's
went
done.
to Cambridge. And
there are a number of things that we want to try and get into. We don't have you for very much longer. You had your own cancer diagnosis, and the NHS has helped you with your cancer diagnosis. One of our colleagues at Lewis Women and a number of women that were supporting Lorraine Kelly's Change and Check campaign went down to Parliament yesterday and made a protest about Enhertu, which is this drug that you can get on the NHS in Scotland, you can't get in the UK. We've had Sophie Blake on. It would extend her life by 2 years. She's got a young family. Is that something, Wes, that you're going to be looking at, the opportunity to actually bring that in, to make it available for these women? Because extending their life for a couple of years when they're facing this shouldn't be about a postcode and where they live.
Yeah, I am really concerned about this, and as a general principle, I don't like postcode lotteries. We'll get further advice back from NICE, which is the independent regulator. What they try and do on behalf of all of us is to make sure that drug companies can't take the mick on price, and they both look at the evidence about is a drug effective, but then they also look at what price are you going to sell it to the NHS on, and they're trying to drive down the price. And I think we've got to give them the space to do that. But I take my hat off to the campaigners. My Instagram has been absolutely filled this morning with women tagging me in. I know how strongly women feel about it.
So it's a priority for you
and if you know someone who's affected by it, it is so personal. And I'm following the campaign closely, and I'll wait and hear the recommendations from NICE.
That'll be good for them to hear. When you, during the election, you pledged a number of things. You pledged you were going to have 2 million more operation scans and appointments a year. You're going to use evenings and weekends by giving £1.4 billion over town, doubling the NHS scanners, bringing waiting times down significantly. To do that, one of the things you've got to do is you've got to settle this pay dispute with the doctors. I know you've met them already. Where are you with that? Do you feel like there's a solution around the corner? I
think we started off on the right foot. I mean, the first thing I felt I had to do was to start rebuilding trust between junior doctors and their government, which has been broken. And I couldn't believe it. I mean, I asked them, you know, look, when was the last time you met the health secretary? It was back in March. We had a 5-day strike the week before the election, and I just thought, the first thing you've got to do is just talk to people.
I think the health secretary would, at the time, the ex-health secretary would have argued that they weren't offering any compromise to their 35% pay request. And until they were offering some sort of compromise, there was no reason for them to sit down. They needed to come either way. There needs to be a bit of give and take, just as a...
Well, I found so far with the junior doctors that, yes, they've got their demands and they've got their priorities, and we got into a bit of that earlier this week. I'm seeing them again next week. That's the sort of pace I want to move at. But they've also shown a willingness to compromise, and I think the weight of responsibility that's resting on all of our shoulders is that these strikes aren't in the interests of patients. See more than 1 million delayed cancelled operations and procedures. Not in the interest of junior doctors who are out on strike. Not in the interest of the taxpayer. Over £3 billion wasted on the costs of these strikes.
But you can't afford 35%, can you?
No, and I was really honest with them before the election. That was so important to me because, again, it's about respect. I know that was a hard message for them to hear, but you know, contained within that honesty is the respect I think they're owed. I was also honest with them this week about the constraints we're under. We've got the worst economic inheritance of any incoming government since the Second World War. So those fundamentals are really challenging, but I'm confident if we continue to show that mutual respect, if we work together to find a way through, that we will make sure that not only junior doctors end this dispute, but we work with them and all the rest of the NHS staff to get our NHS back on its feet and fit for the future, so it's there for all of us when we need it.
What about mental health? Are you going to put that as a priority? We saw the ladies talking about it there too.
Yeah,
there feels as though there's so many people who are slipping through the net, and then it's becoming a problem further down the line. What are you going to do about that?
And we're going to make mental health support available in every primary and secondary school in the country, which would be really important for young people. Yeah. We're going to recruit an extra 8,500 mental health workers to cut the waiting list that currently stand at more than 1 million. And we're also going to make sure that in every community there are walk-in mental health services available. All of that will mean that we can stop people from reaching crisis point. And I'm really glad, you know, you touched on it a bit in the previous discussion about men's mental health, and ITV have done a hell of a lot on this topic. It is the single biggest killer of young men, suicide. It's an issue that I take really seriously, and I think we can make a real difference on mental health and finally walk the talk.
In terms of talking the talk as well, GPs, our viewers will be sitting at home going, you've got to ask about GPs. How are we going to turn around GP services? What is the first port of call for you to try and reduce that lottery, the 8 o'clock carnage that happens when you're trying to get a GP appointment?
So over the course of the Parliament, we'll be training up thousands more GPs, which will be important. I've also asked the officials to start looking at the red tape that's currently tying them up, that we can reduce the burden, because if they're spending less time on that, they can spend more time with their patients. And we've also got this absurd situation in the country at the moment where patients are struggling to find a GP, but GPs are also telling us they're struggling to find jobs. So I want to try and solve that problem, because that seems completely daft. Because also, if someone can't see a GP, which costs about 40 quid for an appointment, they can end up in A&E, which costs 400 quid. And that's why I make the argument so often. I know the NHS needs investment. People will always make that case. We've also got to make sure the money that's going in is being well spent too, and that's a really good example of how currently it isn't.
We have so much more to talk to you about.
Well, I'm very happy to come back.
Please do, Wes. It'd be great. The previous government wasn't particularly excited about coming into studios. I know that my colleagues at Good Morning Britain would have loved to have spoken to a few of them. It feels like you lot are much more open to the idea of being asked questions of, because our viewers love to hear what you have to say. So
yeah, and we want to rebuild trust in politics as well, so we're happy to come back.
And your dad even voted Labour this time for the first time.
First time ever. And I wouldn't normally leap from the Cabinet, but honestly, it was one of the proudest moments of my life when in Keir's opening remarks, the first ever Cabinet of the 2024 Labour government, Keir talked about not just repaying the trust given to us by people who voted for us, but particularly talked about former Conservative voters who voted for us the first time, including Wes's father. And to hear my dad referred to by our Prime Minister around a Cabinet table at which I was sat, if you told that kid from Stepney that's where he'd be in 40 years later, I would never have believed it. And I pinched myself sat there at
proud
that
moment.
Yeah,
you still chose,
very proud of my dad.
You still chose Arsenal over West Ham, though, which I'm struggling with.
I went with my mates over my dad, and he's never quite forgiven me for that.
I'm with your dad on that. Thank you for coming in.
Wes, that was great.
Thank you very much.
Thank you for visiting our This Morning YouTube channel. We upload new content every day, so go ahead and hit that subscribe button so you don't miss out. And we'll see you in the morning.